If you decide that you want to be an activist, you are a leader when you decide to do this. And whoever you activate, you have to be. So you have to know that these people are relying on you in some ways because they don't have a voice, and you're that voice. My name is Camille Clarke-Smith. I'm currently a senior strategic analyst at the UPMC, but I'm also the executive director of T.H.A.W, a nonprofit organization which stands for Transforming the Health of African American Women, as well as I own my own business, Camille Clarke LLC, where I go to clients' homes and I exercise physiologists basically. I train them, motivate them, inspire them to continue increasing their physical activity, but I guide them one-on-one in their training. I used to be 285 pounds, and I was my first client, basically, understanding as time went on what it meant to live a healthy lifestyle. You know, size isn't anything to me, but it was more of I wanted to be healthier, and I became the image. I was a motivation. Like other people in my family started to follow what I was doing, and I realized other people, you know, how Camille's Fitness even came up was someone was like, "Oh, I saw you lost weight. Can you train me?" I'm like, I don't know anything about training. While I was in undergrad, I realized I really have a passion for this. And working at my husband's church, I met a lot more women who were dealing with the same things, the multiple roles they were playing, the stress of it all, and the emotional eating and the lack of physical activity, where I felt like I need to advocate for this. And you know, that's how T.H.A.W, which is a project, you know, I said I'm the executive director, but it's a project that actually stemmed from here. That was my call to action, to tell people to get more physically active, and I called it T.H.A.W, which was thawing the mindset, changing the way that we look at things, and you know, going from surviving to more thriving. So what I did with myself became my inspiration, and how other people looked at me became my next inspiration, because even when I didn't think I was anything, because even if you look at my clients, they're all CEOs. Remember, people, some of them are men, and they come to me like, how did you get him to listen to you? Like one client, his workers will come in, like, how do you get him to listen to you? Could you beat him up for me? So to know people like that actually listen to me and they'd rely on me for their health was what made me realize maybe I need to be a leader in this. Maybe I need to be an activist in this when it comes to health. So that's where it stemmed from. When I looked at the statistics and looking at the news, I realized the health disparity for African American women is by far greater, and I felt almost like a hypocrite. Like, how could you go out and help these people, but you weren't helping your own people? So I sat and I moped, and I would say somewhat of a depressive kind of state, which then this program at Pitt came up. I was in the first year of the EDD program at Pitt, and and then I met my husband at the same time, which had me being able to see these women on a daily basis and get closer to them. And I have to admit, so this, and a little sidetrack, but when I first went into the church, I thought, oh, I could change them. I've changed so many different people. They're gonna listen to me. I'm Black. I understand them. No, they were like, you don't know my struggle. They called me closet white or whatever. You eat like a white girl. You dress like a white girl. You talk like a white girl. You're thin like a white girl. And I was sad because I thought I could make a change, but what I did was I sat back and I listened and I observed and I understood and I had conversations. And now as a church, we've collectively lost about 700 pounds as a church, and we're doing a lot of health promotion things. If I change my church, then we can start to change the community. And if we change the community, then we can change a culture. So that's the way I look at it. You can make one small change, and that small change can sporadically, one person hits 2, hits 4, hits 6, and it spreads. So to know that I'm doing my part. Activism, it means you see a problem. So for a problem, and you want to advocate for that problem. So for me, health, you see an issue with health, whether it's healthcare or health disparity, and you want to advocate for that. You want to change policies. You want people to hear you. So whether or not you want to change behaviors within individuals, so if you look at the ecological model, individuals, or you want to change a community, and in turn, you really want to change that policy, so it falls back down. So for me, activism means changing the individual to hopefully change the policies that affect that individual so they can live within their society and be better citizens within that society, healthier, better citizens within their society. I believe I'm a health activist because I push health and daily activities and changing lifestyle, healthy lifestyle behavior. That's a passion. That's my prevention is the key for me. But to fine-tune it to what I'm doing now, it actually was brought about by Salk. The great thing about this fellowship was the connections that you allowed us to make, because I don't know if anybody else did, but the connections that you made, that I made here, I'm currently still using them. And you follow us throughout the whole time. You know, one of the things that I felt good is like when I first started, when I got my nonprofit 501c, I immediately emailed you guys and said, thank you so much, because it was this Salk fellowship that created that. Angela Perry, which is actually the person who hired me at UPMC. She really believes in patient-centered care. She really believes in the holistic kind of care, how we need to create a community around this patient if we want them to change their health behavior. Let's not just put them in a bucket, but how can we coordinate the best health for this member? And I really love that, and I want to see that actually disseminate everywhere, you know, where it becomes more about that patient-centered care. Start being a part of programs that really hit your passion. Start putting yourself in those places. So if you have a passion for me with African American women, just put yourself in the African American community. Understand that community and become that community, just like that doctor just said. And even if you don't worry about the money, don't worry about where the future is going to come from. Because the truth is, if you truly live in your passion and purpose, you don't even have to worry about that. And just continue, even if it feels like you're not getting anywhere. I'm telling you, there you are, because 6 years ago, I would not have thought I would have been here. And to know my board for T.H.A.W is filled with physicians, filled with CMU professors, it's filled with CEOs. And I'm thinking, you bought into my vision? And they knew me from when I was like 25, and that's because, no, they're telling you, we've seen you being an activist on this for a long time. We've watched you this whole time. So though you haven't been doing anything, we saw your passion, and that's what we're buying into. Don't just consume knowledge, practice wisdom.